This is going to be very interactive, or it will be torturous. So please, comment, questions, cases are great. If you have anything you want to add to this, that would be super. We're going to talk about complex PTSD. And to do that, we have to sort of back up and look at traumatic stress across the spectrum of reactions. So if you could just indulge me for a second. A lot of work has been done to try to identify what is the typical human responses to overwhelming events. Okay? And there's been just a tremendous amount of work been done in this area. Since really every major conflict, in the United States, there's been a literature that emerges about trauma and traumatic stress going back to our Civil War. There's psychiatric writings. The problem is that in between those conflicts, this information tends to be forgotten. It tends to go underground and have to be rediscovered. And what happens each time is it gets a little more complicated, a little more sophisticated, and a little more controversial. So what I'm going to say is going to be controversial to some of you, I hope. Or not. But please, let's have some good discussion about it. I think trend has been to think about human reactions to trauma in a similar way that human reactions to any kind of stress that we've thought about, which is not a sort of single point of reactivity, but rather a continuum with a variety of changes over time and a variety of levels of distress depending on the person's ability to withstand what's happening to them, which can change day to day. Does that make sense? So think of it as a moving target, if you will. Why? Because our ability to cope can be a moving target. All of you know what it's like to have something really stressful happen. Being in training for many of you, just happened those days. And you know that if you've had a really good week or a really good month, that one stressful day impacts you very differently than if you've had 12 of those really stressful days. So we're up and down. Our coping tends to look that way a lot of the time. And so naturally our response to trauma would in part depend upon our state going into that event. Would anybody want to argue that? Because that's kind of the basis of what we're doing. The idea that we don't all experience trauma equally, that what we have on our plate, so to speak, has a lot to do with how we react. That flies in the face of a lot of the earlier research and thinking about trauma. We spent so much time focusing on you have exposure to an event, okay, that's criterion A in the DSM for PTSD, and then you develop these reactions. Very little to, hey, what was over here to begin with? How was that person doing? How much suffering was in their life before they encountered this trauma? So what I'm going to encourage you to do is bear with me and take that broader perspective. Okay? When we talk about complex PTSD, that's going to be essential because if you believe the construct, what you'll see is that it, by definition, involves long-term exposure to multiple trauma. So to start the continuum, there's a range of post-traumatic reactions that are within the realm of what most of us would consider normal adaptation. Right? Fawner become fight or flight. Sellier's idea of the general adaptation syndrome, all those old kind of part and parcel ideas about stress. We know that some people respond with behavioral and psychological reactions that actually work against survival. Okay? Against survival, where most of our physiology and most of our training prepares us to survive. That human stress response is there for the reasons you all know and allows us to mobilize our internal resources to survive threatening situations. Right? That's kind of a commonly accepted idea. But some people, it's the opposite. Their reactions at the moment of trauma, in theory, would put them at more risk. And one example of that is the freezing reaction that many people experience. I work a lot with law enforcement, so where I see that a lot, where I hear people talk about it a lot, is in situations where the trauma is essentially life-threatening, and they have to react to it. And they have to react to it in a way that most of us don't. They have to kind of move toward it. Most of us tend to run the other way. These folks actually have to run toward it. Some of them do that very well. They adapt to that threat. Sometimes, though, they don't, and they freeze. And that freezing, and it's a freezing that can be behavioral, so they physically just become immobile, or most often it's a cognitive shutting down, so that their training and their experience essentially is unavailable to them in that moment. And so the end point is they don't perform the way they wanted to. And in some situations, that's life-threatening, for them or for somebody else. So that's an example of a reaction that many people may experience, but it doesn't bode well. What's really interesting is that when people have reactions that tend to go against what you would expect from the fight or flight physiology, those reactions put them at greater risk for post-traumatic stress disorder. Freezing, fainting, the more, if you will, take it with a grain of salt, the more parasympathetically mediated reactions, when you have those in the moment of trauma, tend to correlate with higher risk of PTSD. It's a little scary. The other thing we really haven't focused a lot on in the traumatic stress literature is the role of trauma in engendering superior performance. Traumatic stressors, for some people, bring out the best in their ability to perform. Other people completely overwhelm. And this has not been really talked about as much, although there is a literature on this, and there's a literature obviously on stress and performance. Where this tends to show up are in situations where performance is crucial to one's occupation. So those are where if you do freeze, if you do lock up cognitively, either yourself or someone else may be seriously injured or killed. That's where the situations show themselves. So there's a whole range of during the trauma sort of behaviors and cognitive changes that we can experience, many of which are normal. Many people argue that most reactions during a traumatic event are normal reactions to an abnormal demand on the person. Okay, that's a debatable concept too. Want to debate it? You debate it? No? You got to debate it. So this idea of a normal adaptation to an extreme event has been around for a long time. And for a lot of people, this is a very destigmatizing way to reframe post-traumatic distress. So that's one of our interventions that in acute trauma work, critical incident stress, acute trauma in a medical setting, one of our goals is to educate people about common reactions, to normalize it, to help them feel less distressed by their own symptoms, if you will. Does that make sense? So we try to normalize. One of the problems with that is that we're not quite sure necessarily what is normal and what really crosses that line in terms of predictive value of being dysfunctional later. That's tricky. Mostly we try to reframe things as normal because we believe that, but understand that's kind of a debate too. And there's some biological, psychobiological evidence that not everything is a normal adaptation. The people with PTSD do have clearly different reactivity patterns. And that may predate the trauma, or it may be a result of the trauma, or for some people. Boy, that's depressing, isn't it? The other thing that we know, and it's really important, is that the majority of people who develop more immediate post-traumatic distress or post-traumatic symptoms following an event recover spontaneously. The majority of people who experience trauma, and even the majority of people who develop symptoms, they are self-limiting. Give people a week to 2 to 3, mostly they don't look like they have PTSD at a clinical level. Subclinical for sure. So most of it resolves. What percentage of people who experience a DSM for trauma develop PTSD? If you lump all the types of trauma together, what's the prevalence of it? People exposed, what percentage develop PTSD? If you lumped every type of trauma together?
5 to 10.
Yeah. absolutely fun to